Obamacare is a horror. And I knew that when they were trying to enact it. In fact, led a group that tried to prevent it and then to defeat those who voted for it, because I knew that the idea that you could keep your health care plan or that it was not going to hurt the economy was completely bogus. I would repeal Obamacare, but I would replace it with patient-centric, privately marketed policies that provide good quality health care to low-income working Americans. Again, this is something I did before Obamacare. When I talked earlier about having over 1 million fewer people on welfare, part of it was to change the paradigm where a low-income person thinking about getting that first $8, $9, $10 an hour job looks at their economic benefit. And if they're on welfare, health care is provided through Medicaid. They don't have to worry about what happens to their kid during the day if they're not in school because they're home. So what we did is we put in place 2 new health care programs. Family Health New York, where the state of New York sponsored a program, privately marketed, where private insurance companies would sign up low-income working adults above the Medicaid level, and you could get insurance for something like $6 to $8 a month if you were earning $20,000, $22,000, $24,000, $26,000 a year. So we filled that gap. Also, small businesses and entrepreneurs, or someone who worked in a business that didn't offer health care, was trapped out of the market. So we created a program, Healthy New York, and we had hundreds of thousands of small businesses and employees of small businesses pool together and get very low-cost quality health care. And both of these we supported by the state's tobacco revenues. The Healthy New York program became rated so highly that we didn't need to subsidize it at all. It worked. They were both wiped out when Obamacare came in. One of the reasons we're not growing the economy the way we should is there are between 6 and 8 million Americans who are working less than 30 hours a week, not because they want to, but because Obamacare forces their employer to keep them under that 30-hour threshold. There are also many companies, and I know some, that don't just grow beyond 50, but I know of companies that had 60 or 70 that went down to 49 to avoid being under Obamacare. Repeal Obamacare, put in place market-driven opportunities for workers who otherwise wouldn't have access to health care, reform our tort system. The junk lawsuits against manufacturers, against hospitals, against doctors are hideously driving up costs and reducing economic growth and opportunity in this country. We can change that, and we will have a far better health care system. We won't have these spiraling costs and $5,000 deductibles, and we will have more jobs and a stronger economy.